1. Disfluencies. Use common English disfluencies naturally, especially at the beginning of thoughts or when searching for a word. Don't overdo it, as the speakers are knowledgeable. Examples, sort of, kind of, snippet, host speaker. So the first thing is essential obesity, right? Expert
Sure.
speaker. Yeah, that's a big one. And then high triglycerides, too. 2. Fillers. Employ common filler words to bridge thoughts or manage the conversation flow. Examples. Also, right? Okay, actually, you see, snippet, host speaker. Okay, so that makes sense for type 1, expert speaker. Right. Now for type 2, well, it's a bit different. 3. Hesitations, natural pauses. Imply slight pauses within speech, often before a key term or when transitioning. The TTS system will handle the actual pauses, but the phrasing can suggest them. Short sentences can create this effect. Snippet, host speaker. And the diagnosis involves looking at several things together. Expert speaker. Exactly. You need at least 3 out of those 5 criteria we mentioned. 4. Repetitions, restarts. Occasionally have speakers repeat a word or restart a short phrase, especially if interrupted or slightly rethinking. Examples. It's really about insulin resistance. We need to look at the blood sugar levels. Snippet. Expert speaker. The main issue is this autoimmune attack. Host speaker. An attack on the pancreas cells. Expert speaker. Yeah, the beta cells specifically. 5. Interruptions, overlaps. Allow speakers to interject agreement, short questions, or start speaking slightly before the other finishes, especially on transition points. The line-by-line format handles this structure. Snippet, host speaker. So lifestyle changes are key for type 2. Diet, exercise, expert speaker. Absolutely, that's the foundation, really. Weight loss, too, if needed. Host speaker. Right. 6. Back channeling. Include brief interjections from the listener, in this case the other speaker, to show engagement. Examples. Right? Okay, I see. Yeah. Snippet, expert speaker, and that can lead to things like retinopathy. Host speaker, affecting the eyes. Expert speaker, exactly. And nephropathy, which is the kidneys. Host speaker. Okay. 7. Contractions. Use contractions extensively as they are standard in spoken English. Examples. It's don't, can't, we're, they're, yell, what's, snippet. Host speaker. It's interesting how they're linked. Expert speaker. Yeah, you can't really talk about one without touching on the others, 8. Colloquialisms in formal language. Incorporate natural, informal phrasing appropriate for a conversational podcast. Examples. Dig into, unpack, get a handle on, warning signs, red flags, down the line, big picture, feedback loop, sneaky, snippet, host speaker. Let's get into the risk factors now. Expert speaker. Okay. So for type 1, one of the big ones is genetics. 9. Sentence fragments, shorter sentences. Break down complex ideas into shorter sentences or even fragments where natural. Snippet, expert speaker. Metabolic syndrome, often no obvious symptoms. Sneaky, host speaker. Right, so a bigger waveline might be the main clue. Expert speaker, pretty much. Yeah. 10. Tag questions. Use tag questions sparingly for confirmation or to maintain engagement. Examples. Or 10, how to snippet, host speaker. So insulin resistance is central to both type 2 and metabolic syndrome, right? Expert speaker, that's a key link, definitely. 11. Direct address. Continue addressing the listener as you. Snippet, host speaker. And you sent us some really great material on this expert speaker. Yeah, it's aimed at healthcare students, so it gives you a solid foundation. 12. Varying sentence structure. Make shorter interjections with slightly longer explanations to keep the rhythm dynamic. Snippet, host speaker. Okay, type 1. What are we looking at symptom-wise? Expert speaker. Well, there are the classic 3 Ps. That's polyuria, so frequent urination. Host speaker. Expert speaker. Polydipsia, which is increased thirst, and polyphagia, increased hunger. Plus things like fatigue, maybe blurry vision. Host speaker. Got it.
Welcome back to the deep dive. So you sent us some really interesting material, looks like excerpts from a chapter for future healthcare professionals, all about diabetes and metabolic syndrome.
That's right. Yeah. And our plan today is to really sort of unpack it all, figure out what it means for, understanding how these health issues are connected.
Okay. So we're going to dive into the risk factors.
The signs to watch out for, the kind of the science behind it all.
What's happening inside the body.
Exactly. And also, how doctors diagnose these conditions, how they're managed, and importantly, the potential long-term consequences.
And why should you, our listener, care about this deep dive? Well, getting a handle on diabetes and metabolic syndrome, it really gives you valuable insight into your own health risks, maybe people you know.
Yeah, and just the broader health landscape. I think you'll find some surprising connections, some real aha moments as we see how these things link up.
Definitely. Okay, so let's get started. Let's lay the groundwork first. What are we actually talking about with type 1 diabetes, type 2 diabetes, and metabolic syndrome? How are they distinct?
Right. It's crucial to get these definitions clear from the start. So type 1 and type 2 diabetes mellitus, they both involve high blood sugar, but They get there very different ways.
Okay.
And metabolic syndrome, well, it isn't actually diabetes itself, but like the material says, it's a cluster of conditions that increases the risk of heart disease, stroke, and diabetes.
A cluster, like a warning sign collection.
Exactly. Think of it like that, a constellation of warning signs that often pop up before, more serious problems develop.
Okay, so what makes up this cluster then? What are the specific things doctors look for with metabolic syndrome?
There's a clear set of criteria. You need to have at least 3 out of 5 specific things going on. First, excess fat around the waist, what they call central or abdominal obesity.
Right, the belly fat.
Then, high levels of triglycerides, that's a type of fat in your blood. Third, low levels of HDL cholesterol.
The good cholesterol.
That's the one that helps clear fat out. Fourth is high blood pressure or hypertension. And fifth is elevated fasting blood glucose. So higher blood sugar when you haven't eaten for a while.
3 out of 5 of those. Got it. Okay, so those are the pieces of metabolic syndrome. Now, what puts someone at risk for developing these conditions? Let's talk risk factors.
Okay. For type 1 diabetes, the big factors are usually genetics, like having a family history.
Right.
An autoimmune issue, where the body's own immune system basically attacks and destroys the cells in the pancreas that make insulin, the beta cells.
The body attacks itself.
Exactly. And potentially some environmental triggers too, maybe certain viruses.
And type 2 diabetes seems more linked to lifestyle, doesn't it, based on the material?
Absolutely. The sources really highlight obesity, particularly that abdominal fat again.
There it is again.
Yeah. Also, a sedentary lifestyle, not much physical activity. And like type 1, family history plays a role here too, specifically for type 2.
Okay, what else?
Other key risk factors include high blood pressure, dyslipidemia, which is just unhealthy levels of fats like cholesterol and triglycerides in the blood.
Right.
Being over 45 years old and having a history of gestational diabetes, that's diabetes during pregnancy, or maybe delivering a baby who weighed over 9 pounds.
Interesting connection with pregnancy. And for metabolic syndrome risk factors, it sounds like it's basically those diagnostic criteria we just listed.
Pretty much, yeah. Having that central obesity, the high triglycerides, low HDL, hypertension, elevated fasting glucose, these are both the definition and the risk factors. It's sort of a feedback loop.
Okay, that makes sense. So we know who might be more likely to get these, but how do they actually show up? What are the signs, the symptoms people might notice?
Well, for type 1 diabetes, there's that classic trio, sometimes called the 3 Ps. That's polyuria, meaning you have to pee a lot more. Polydipsia, being really thirsty. And polyphagia, feeling much hungrier than usual.
Okay, the 3 Ps.
Right. You might also see unexplained weight loss, feeling really tired, maybe blurred vision. And in serious cases, something called diabetic ketoacidosis, or DKA, which is a medical emergency.
That sounds pretty noticeable. Different from type 2, which you said can be quieter at first.
That's right. Type 2 often starts, without any obvious symptoms at all. It can be quite silent initially.
So what might someone notice eventually?
As it progresses, yeah, people might start feeling fatigued, notice blurred vision, maybe that same increased urination and thirst we see in type 1.
Okay.
Also, wounds might heal really slowly, or they might get frequent infections, like yeast infections are common.
And metabolic syndrome. The material said it often lacks clear symptoms, kind of sneaky.
Yeah, exactly. It's often very subtle. There aren't really specific symptoms that make you think, I have metabolic syndrome. A larger waist circumference is probably the most visible sign.
They might not feel it directly.
Right. Any other signs are usually tied to the individual parts, like maybe you find out you have high blood pressure at a checkup, or your blood sugar is a bit high in a routine test. But you might not feel those things until they're quite advanced.
Okay, so we've covered risks and signs. Let's get into the why now. What's actually going wrong inside the body, biologically speaking, with each of these?
Good question. So in type 1 diabetes, the fundamental problem is that autoimmune attack we mentioned.
Yeah.
The immune system destroys those insulin-producing beta cells in the pancreas.
Right.
So you end up with an absolute lack of insulin. And insulin is like the key that lets glucose, or sugar, get from your blood into your cells for energy. No key, sugar stays stuck in the blood.
Total insulin deficiency. And type 2, how does that mechanism differ?
Type 2 is primarily about insulin resistance. The body's cells just don't respond properly to insulin anymore. It's like the locks on the cell doors are getting rusty or jammed.
So the key doesn't work as well.
Exactly. And initially, the pancreas tries to make up for it by pumping out more insulin.
Yeah.
But over time, those beta cells can get exhausted, and their ability to secrete enough insulin starts to decline.
Okay. And what about the engine driving metabolic syndrome? What's the core mechanism there?
Well, insulin resistance is definitely a central feature of metabolic syndrome too. That's a huge link between it and type 2 diabetes.
I see.
But it's probably not the only thing. There's also evidence of chronic, sort of low-grade inflammation throughout the body. Problems with how the body handles fats, dysregulation of lipid metabolism. It's complex.
It sounds like a web of issues.
It really is. But that insulin resistance seems to be a really key thread tying things together.
This interconnectedness is definitely becoming clearer. Okay, so if someone might have one of these, how do doctors actually diagnose them? What tests do they use?
There are several key lab tests, especially for diabetes. A fasting blood glucose test is a big one, checking your blood sugar after you haven't eaten for at least 8 hours. A level of 126 milligrams per deciliter or higher usually indicates diabetes.
Okay, 126 fasting.
Right. Then there's the HbA1c test, glycated hemoglobin. Think of it like an average report card for your blood sugar over the last 2 or 3 months.
Ah, the longer view.
Exactly. A result of 6.5% or higher points towards diabetes. You can also diagnose it with a random plasma glucose test if it's 200 milli-GDL or higher and the person has symptoms.
Like the 3Ps.
Or through an oral glucose tolerance test, the OGTT. That involves drinking a sugary drink, and if your blood glucose is 200 milli-GDL or higher 2 hours later, that's also diagnostic.
Okay, several ways to catch diabetes. And for metabolic syndrome, you're looking at that cluster again.
Precisely. Since it is a cluster, the diagnosis involves measuring those different components. So a lipid panel is essential checking cholesterol, triglycerides,
Right.
blood pressure measurements, obviously for hypertension, and measuring the waist circumference for that central obesity piece. You need the results from these different areas to see if someone meets the criteria.
Makes sense. So once someone is diagnosed, what are the main treatment approaches? How are these managed?
For type 1 diabetes, since the body makes no insulin, the cornerstone is lifelong insulin therapy. That's usually delivered through injections or an insulin pump.
Right, replacing what's missing.
Exactly. And alongside that, regular blood glucose monitoring is absolutely critical to adjust the insulin doses. Diet and exercise management are also key parts. And education knowing how to prevent DKA.
Okay. And for type 2, where insulin resistance is the main issue, what's the first line of attack?
For type 2, management usually starts with lifestyle changes. Big focus on diet modification, getting regular physical activity, and weight loss if the person is overweight.
Lifestyle first.
Yeah. Then, often, oral anti-diabetic medications are added. Metformin is a very common first choice. It helps improve insulin sensitivity and reduces glucose production by the liver.
Okay.
There are other oral meds too. And sometimes, especially in more advanced cases, insulin therapy might become necessary for type 2 as well.
And metabolic syndrome. Sounds like tackling those individual components is the way to go.
That's exactly it. The main strategies are really about addressing those underlying risk factors. So weight reduction, changing the diet, typically lower fat, lower sugar, and increasing physical activity.
Back to lifestyle again.
Fundamentally, yes. But then you also manage each specific part. So controlling the blood pressure, getting lipids like cholesterol under control, managing blood glucose, and often medications are needed for these things. Statins for cholesterol, antihypertensives for blood pressure, maybe anti-diabetic drugs if lifestyle isn't enough to control blood sugar.
Right. It's clear managing these is vital. Because if they're not managed, well, the material outlines some serious potential complications down the line, doesn't it?
Absolutely. Uncontrolled diabetes, both types, can cause damage to blood vessels throughout the body. We talk about microvascular complications affecting the small vessels. That leads to things like retinopathy.
In the eyes.
Yep. Nephropathy in the kidneys.
Kidney damage.
Right. And neuropathy, which is nerve damage, often in the feet and hands.
Okay, small vessels. What about larger ones?
Then there are macrovascular complications, damage to the large blood vessels. This significantly bumps up the risk for coronary artery disease, so heart attacks, stroke, and peripheral artery disease, which reduces blood flow to the legs and feet.
Serious stuff. And there were those acute complications mentioned too?
Yes. Diabetic ketoacidosis, DKA, which we mentioned earlier, is more common in type 1. It's a dangerous buildup of acids called ketones in the blood. And then there's hyperosmolar hyperglycemic state, or HHS, seen more often in type 2. That involves extremely high blood sugar levels and severe dehydration. Both are emergencies.
Wow. Okay. And untreated metabolic syndrome, what's the risk there?
Well, letting metabolic syndrome go unaddressed significantly increases the chances of developing full-blown type 2 diabetes.
Ah, so it's often a precursor.
Very often, yes.
Yeah.
It also dramatically raises the risk of cardiovascular disease, heart attacks, strokes, and ultimately Untreated metabolic syndrome is linked to an increased risk of dying earlier. It really highlights why catching and managing those risk factors is so important.
Definitely. The material also briefly touched on special populations. Are there specific groups where these conditions present unique challenges?
Yes, definitely some important points there. We're unfortunately seeing type 2 diabetes more and more in kids and teenagers, and that's largely tied to the rise in childhood obesity.
That's concerning.
It is. For pregnant women, there's the risk of gestational diabetes, which needs careful management because it can affect both the mother's and the baby's health.
Right.
In older adults, managing diabetes and metabolic syndrome can be trickier. They often have a higher risk of complications, and they might be taking multiple medications for other conditions, polypharmacy, which can complicate things.
Makes sense.
And finally, the sources note, and it's well established, that certain ethnic groups, including African American, Hispanic, Native American, and Asian American populations, unfortunately have a higher risk of developing type 2 diabetes and metabolic syndrome.
Important disparities to be aware of. This has been really thorough. I like how the material you shared sort of creates that cheat sheet structure: cause, risks, symptoms, labs, treatment, complications, special populations for each one, type 1, type 2 metabolic syndrome.
Yeah, seeing it laid out like that side by side really helps clarify the key differences, but also where they overlap,
Absolutely. It drives home those core distinctions and similarities. Okay, so as we wrap up this deep dive, looking at this material aimed at, future clinicians, it's really striking how these conditions, type 1, type 2 metabolic syndrome, while they have different starting points, they are just so deeply interconnected. Understanding one really does shed light on the others.
It really does. And when you think about that interplay, the risk factors feeding into the mechanisms leading to potential complications, it kind of makes you step back and think, doesn't it?
Yeah, like what are the most impactful things we can do proactively for long-term health, both for ourselves and maybe, thinking bigger picture?
Exactly. It raises those kinds of questions. Hopefully this discussion gives you, our listeners, a really solid foundation for thinking about these conditions and maybe understanding future health news or information you come across.